Hello, and welcome to this orientation webinar for the Learning Collaborative on Workforce Recruitment and Retention with a focus on behavioral health. This collaborative is sponsored by the Central East Mental Health Technology Transfer Center, and the local sponsor is the Pennsylvania Association of Community Health Centers. The technical assistance provider for this initiative is the Annapolis Coalition on the Behavioral Health Workforce. My name is Michael Hoagie, and I will be leading the collaborative along with my colleague, Dr. Manny Paris. The collaboratives were developed by the Annapolis Coalition in response to the recognized need to help providers better find and keep their behavioral health workforce. The initial collaborative was offered in the state of Maryland, funded by the Central East MHTTC. We have operated coalitions or collaboratives in the state of Ohio, and will be opening the next collaborative in Washington, D.C. This particular collaborative that you will be participating in is unique in that it is the first that we are offering for FQHCs and rural health clinics, with a specific focus on helping them find and keep their behavioral health workforce. In terms of the Learning Collaborative process, it will begin with a Learning Collaborative in-person meeting. This will be followed by time spent in developing a recruitment and retention plan within each organization that participates, then beginning to implement that plan. And along the way, you will receive technical assistance from the Annapolis Coalition on implementation of the strategies that you have adopted. We will ask for you to provide us with every other month updates on your plan, and ask you to participate in 3 virtual meetings of the collaborative, where all participating agencies will discuss the interventions they've selected, the progress they're making, obstacles they are encountering, and their plans regarding sustaining the progress that they begin to make in the collaborative after the collaborative comes to an end. In terms of Learning Collaborative content, we will provide you with an education about how to identify your primary recruitment and retention challenges and goals. We'll provide you with information about best practices in recruitment and retention. We've identified 35 strategies that have relevance to behavioral health organizations and to FQHCs and rural clinics that are recruiting behavioral health workers. We will provide information on measuring recruitment and retention variables, on creating strategies that will help you achieve change within your organization, and again, for sustaining plans and change once you're underway. We have a specific template that we will provide to you for building your recruitment and retention plan, and you'll have the opportunity for peer learning during this collaborative as you hear about some of the strategies that your peer organizations have adopted and found to be helpful. So this is a unique collaborative in that we are focusing on behavioral health, but we are focusing on it within organizations who have had a broader mission, namely those organizations that are FQHCs, FQHC lookalikes, and rural health clinics. And I'd like to read you a paragraph from the request for applications that tries to sort of focus on how we understand the interface between recruitment and retention in these FQHCs and rural clinics in general, and the focus of this collaborative, which is on behavioral health. There will be a focus in the collaborative on the recruitment and retention of behavioral health workers. However, many of the strategies discussed in the collaborative will have applicability to each organization as a whole, including the non-behavioral health members of their workforce. The improved recruitment and retention of behavioral health workers must be the focus of the organization's efforts within the collaborative, and progress on these goals must be tracked. However, participating organizations can strive to improve the recruitment and retention of behavioral health workers by, in part, improving agency-wide recruitment and retention practices. So we will sort of encourage you to focus on behavioral health in this initiative, but to understand and encourage you to look at the recruitment and retention practices in your organization as a whole and how they can be improved to help improve finding and keeping mental health and substance abuse workers. In terms of the organizational commitment, each participating agency has been asked to put together a 3-person change management team, and it is that team that will participate in the one-day in-person meeting in Harrisburg. Also, the responsibility of the team will be to develop, secure approval for, and implement the recruitment and retention plan. It'll be the team that provides the every other month plan updates and develops the sustainability strategies. Again, all with consultation from Dr. Paris and me along the way. And it is the team that will participate in the 3 virtual collaborative meetings. At the end, we'll ask you to submit a brief final report on the strategies that you implemented and the success that you achieved, and give you an opportunity to complete a satisfaction survey so that you can give us feedback to improve future collaboratives. We do ask for an organizational commitment from the CEO, and that is to take ultimate responsibility for the implementation of the recruitment and retention initiative within your organization. And we ask that the leader participate in reviewing this orientation webinar and participate in the final virtual meeting, the conference call of all agencies as the project comes to a close. We also ask the CEO to support the team and the plan, and that means giving input into the team on their priorities and their ideas, to review the plan as it's drafted, to engage the team in discussion and give ultimate approval for implementation of the plan, to talk with the team periodically about implementation progress and barriers encountered, to actively support implementation, and to ensure that the team has the time needed to effectively participate in the collaborative process. So let's get to some specifics. The launch meeting is the in-person meeting. This is the meeting to be attended by the change management team. It is limited to 3 persons, and optimally each change management team will have 3 individuals attending. It will be held on January 28th of 2020 at the Hamilton Health Center, which is located at 110 South 17th Street in Harrisburg, between Market Streets and Dairy Street. There's free parking available in the agency's lot, and you are to use the main building entrance. The organization, the Hamilton Health Center, has what they call badge-controlled access around the building, and so once you're in the building, you'll be greeted and escorted to the 2nd floor where the meeting will be held for the day. In terms of the meeting logistics, the start is 8 a.m. for registration. The meeting room will be open at that time. The meeting will formally start promptly at 8:30, and around noontime we will break for a lunch, which will be a combination of lunch and sort of discussion within your team about your plan. And we will adjourn promptly at 4:30 p.m. on that day. The Pennsylvania Association of Community Health Centers will be providing food and beverage. There'll be water, coffee, and tea in the morning, some light breakfast snacks, and a lunch provided. If you have dietary restrictions that you would like to be considered, please email those in the near future to Amy at her email address, which is amy@pac.org. That's amy@pachc.org. So here are some things that we would like you to do to prepare for the in-person meeting. And in terms of these preparations, again, our focus is on behavioral health and the behavioral health workforce within your organization. So we'd like you to gather relevant information on recruitment and retention. What are your challenges and priorities with respect to recruiting and retaining a behavioral health workforce? What kind of recruitment and retention data do you have on the behavioral health workforce? What have you tried and how has it worked in terms of the efforts to recruit and retain a behavioral health workforce? And what ideas has your organization been thinking about in terms of what you might try next in this regard? And lastly, what obstacles to success might you encounter if you implement those ideas, and how might you overcome them? Where might you find this information? We encourage you, before you come to the in-person meeting, to talk to your leaders and other staff about these issues. You yourself may have institutional memory about the things that you've tried and the things that the organization is thinking about trying. And there may be many documents within your organization that focus on these issues as well. So we encourage you to look for this kind of information, engage in these kinds of discussions, and then for your 3-person change management team to meet at least once to talk about some of these issues before you come to the meeting on January 28th. So with respect to the data that we're asking you to look for, here are some ideas about the types of things that you might find. Your human resource department or your human resource data systems may have information that they have collected and stored that you may be able to access. There may be workforce variables that your organization has been measuring. And again, we primarily want to focus on what you're doing with the behavioral health workforce, but you may be measuring other things with your workforce in general that may have relevance to our work together. The possible types of data that you might have might relate to the characteristics of the workforce. What's their average tenure? What is the racial and ethnic diversity of the workforce? Information about turnover and vacancy rates, or possibly measures of staff satisfaction, engagement, or some exit interview findings. You might have information on application volume and the rate at which offers that you make are actually accepted. The other question to ask as you look at all of these types of data points is whether the data is analyzed in any way. So for example, if you have information on turnover rates, has that information been broken down and analyzed by type of worker? For example, a licensed professional versus paraprofessional residential aid. Is the data separated and analyzed by the program or by the supervisor? So look at the data that you have and look at what your organization has done with the data and how they've looked at that data over time. We want you to have realistic expectations because we have realistic expectations that you won't have all the information or all the ideas when you arrive, but whatever you can gather in advance will help jumpstart your planning process. You'll discuss these issues during the meeting in small group with your team, with Dr. Paris and with me, and perhaps with some of the peer organizations. And those discussions will continue after you finish the one-day meeting and return back to your organization. For the meeting itself, bring whatever information you've been able to pull together because you might want to reference it. We'd like each 3-person team to bring at least one laptop. We will have a template that will be provided to you electronically for developing your plan, and some of you may wish to use the template and work with it during the meeting. We will not be providing any pens and paper, so whatever you need to sort of write on and take notes, please bring that as well. And that's all that you need. The attire is business casual for the day. There's one other request that I would like to make of you, and that is that each of you think about the jobs that you've had over the course of your career. And I'd like you to sort of reflect on how you got those various positions. In other words, to ask yourself, what's your personal recruitment story? What led you to a job? How did you find out about it? What made you decide to take the job? And the second question is, of all the jobs that you had, what kept you in those jobs? So in other words, what's your personal retention story? Please reminisce a little bit about these questions in advance of coming to our in-person launch meeting. So that's the information that you'll need in order to prepare for coming to the start of the collaborative. If you have questions about the collaborative process, email either of the collaborative leaders, and I've printed the email addresses for Dr. Paris and for me here. You may want to consider putting these names and email addresses in your email address book so that your spam blockers don't block efforts from either Manny or from me to email you in the future. So thank you for listening. Manny and I are excited about meeting you and working with you, and we will see you soon.